Hello students. So yesterday we discussed about the part 1 of this lecture where I told you about the different surfaces and their features. Now in today's session we will continue, and today I will discuss about the processes of the maxilla. Now when you will have the maxilla, you know that there are 4 processes. One is known as zygomatic process, one is frontal process, alveolar process and palatine process. So in this image, as you know that this is the frontal process, this is the zygomatic process, this is the alveolar process, and palatine process is not visible in the norma frontalis because it is going to make a hard palate, which is a horizontal plate. So let's discuss all these processes one by one. So first is about the zygomatic process. Now dear students, whenever you will talk about the zygomatic process, in the last class I already told you that this process basically defines the apex of the maxillary sinus, or you can say the bone, because we told that it is a pyramidal bone and the pyramid is having the base which is directed towards the medial side, and this is the apex which is directed towards the zygomatic process. So whenever we are talking about the zygomatic process, it is a lateral projection which occupy the apex of your maxillary sinus. Now the important thing is about the zygomatic process is that there is a presence of line of buttress. Now this line of buttress is basically present along this inferior border of this zygomatic process. Now a ridge ascend from the root of first molar tooth. See, this is the important terminology which you have to understand, that from the first molar tooth. Now you know there are 3 molar, this is the third molar, this is the second molar and this is the first molar. Now along the first molar tooth, a ridge is starting which is forming the inferior border of this zygomatic process. Now this line of the lower border, or you can say the ridge, basically correspond to a part of zygomatico-maxillary buttress. Now zygomatico-maxillary buttress is having a direction like this. Now this is the direction of zygomatico-maxillary buttress. Now what do you mean by the buttress and what is the function of buttress? Now when you will see the buttress is basically the line which is helpful to absorb and transmit the masticatory forces which are applied to the facial skeleton, and this shift these forces to the base of a skull. So whenever there is a mastication, whenever there is a contraction of the muscles of mastication, the force of mastication is transmitted to the periodontal ligaments which are present around the root of the tooth, and from that root of the tooth, this masticatory force is going to transport towards the base of a skull, and along with that these buttress line are helpful to absorb those masticatory forces. So sometimes in exam you will have the question that how the masticatory forces are generated. So these forces are generated by the muscles of mastication during the different movements of mandible. So these are buttresses which are present along the different parts of the skull. Generally you will find the vertical and horizontal buttresses, and this is one of the buttress is known as zygomatico-maxillary buttress. And sometimes you have this question in regarding this zygomatic process of maxilla. Now here this is the line of buttress which is basically also known as demarcation between the facial surface and the posterior surface of maxilla, which is forming the inferior border of zygomatic process. Clear? Now we'll move to the next process, is the frontal process. Now this frontal process is having only one end which is projecting upward, then it is having the 2 borders and 2 surfaces. So now let's see first the end. Now it is having the one end only which is projecting upward towards the frontal bone, and that's why it is known as frontal process of maxilla. So this is going to make a joint with the frontal bone, and the area of frontal bone which is going to articulate here is here. So this is a suture line which is known as frontomaxillary suture. Now this frontomaxillary suture is a area where the frontal process of maxilla articulate with the frontal bone. Now when you will see the borders, there are two borders, anterior border and posterior border of the frontal process. Now this is the anterior border. Now this anterior border is articulating with the nasal bone. So what is the name of this suture line? Nasomaxillary suture. This line is known as nasomaxillary suture. Now there is a one more posterior border, and this posterior border is articulating with this lacrimal bone, and that is known as lacrimomaxillary suture. So anterior border articulate with the nasal bone, posterior border articulate with the lacrimal bone, and upper end articulate with the frontal bone. Clear? Now when you will see the surfaces of the frontal process, this is the one surface which is outer side, and there is another surface which is facing towards the nose, that is the inner surface of the process. So this surface is visible here, and the another surface which is visible from the inner side of the nose, that is the medial surface of the frontal process. So first we will discuss the outer surface, or you can say the lateral surface of the frontal process of the maxilla. Now this surface is divided into the two parts by a vertical crest. Now this is a very important landmark. This crest is known as anterior lacrimal crest. What is the name? Anterior lacrimal crest. This crest is vertical. So this is the important thing. It is vertical crest. Now this crest present on this lateral surface or outer surface of your frontal process, and here it is going to divide this surface into the two parts. Now what these two parts? One is in front of the crest, which is a larger area. One is behind the crest, which is a smaller area. Now this larger area which is present here, which is visible very easily from outside, is providing attachment to the some important structure. One is orbicularis oculi muscle, second is levator labii superioris alachnesi muscle. So that you can appreciate in this image that this is your frontal process of maxilla, and in this process you are able to see this is the outer surface. Now on this outer surface, this is a muscle is known as orbicularis oculi, and this is the muscle is alachnesi. Now here you are able to see this green important structure is known as medial palpebral ligament. It is known as medial palpebral ligament. This medial palpebral ligament attached on the crest. What is the name of crest? Lacrimal crest. So on this anterior lacrimal crest, you will have a ligament is known as medial palpebral ligament, and anterior to the crest, you will have the attachment of the muscles on the ligament and on the surface, and both, which you can appreciate in this image also, that when you will rotate the maxilla, you can appreciate that this is the inferior border of the maxilla, which is known as infraorbital margin, and when you will trace the margin in upward direction, this margin merge with this vertical line, which is known as anterior lacrimal crest. Now this lacrimal crest is dividing the frontal process surface into the large area here and the small area on the inner side. Now this area which is on the inner side is having a notch. There is a small notch is present. Now that notch is going to complete when there is articulation with the lacrimal notch, and ultimately they are going to make a lacrimal groove for the your upper part of the nasolacrimal duct, which is known as lacrimal sac. So this green area is your anterior lacrimal crest, and this is a larger area which is anteriorly, and there is a small area posteriorly which is having a small notch. Now in this small video you can see that this is the area where you will have the medial palpebral ligament. Now from this ligament and on the lateral surface you will have this muscle is known as orbicularis oculi. Now if you will remove the orbicularis oculi, you can see this is the medial palpebral ligament. Now below the medial palpebral ligament, here you can see this lateral surface of the maxilla is giving attachment to the muscle which is known as superior labii alachnasi. Clear? So, these are the important things which you have to understand, that whenever we are talking about the lateral surface, the lateral surface is divided into the two part by a vertical line which is known as anterior lacrimal crest. The crest is the area which is going to attachment for the medial palpebral ligament. In front of the ligament you will have a larger area where you will have two muscles, one is orbicularis oculi and second is levator labii superioris alachnasi. Now, the another important thing is that behind the vertical crest you will have a smaller area. That smaller area is having a small notch which is going to contribute into the lacrimal groove, and when this lacrimal groove will form, when it is going to articulate with the your lacrimal bone from posterior side. Clear? So, this is what is about the outer or lateral surface of the process. Now, we will move to the inner side of the frontal process, that is known as medial surface or the nasal side of this inner side of the process. Now, again on the inner side also you are going to see a oblique or you can say horizontal ridge. Now, this ridge is not exactly horizontal, it is a oblique ridge, and this oblique ridge which is present here on the inner side or nasal side of this frontal process of maxilla is known as ethmoidal crest. This is another crest which is known as ethmoidal crest. Clear? So, one crest is present on the outer side of this process, that is vertical crest. One crest is present on the inner side of this process which is oblique or horizontal crest. Now, this named because this crest provide attachment to the middle nasal concha of ethmoid bone. So, this area provide attachment or articulation with the middle nasal concha of ethmoid bone, that why this area is known as ethmoidal crest. So, what is ethmoidal crest? Ethmoidal crest is an oblique line present on the medial surface of the frontal process, and this is going to articulate with the ethmoid bone. Which part of ethmoid bone? Middle nasal concha. Now, we will move to the another part of this medial surface. Now, this medial surface is again divided above the crest and below the crest. So, this area is above the crest, this area is below the crest. Now, here in this upper part, that means the area above the crest is again going to articulate with the ethmoid bone. That means this whole area is making a joint with the ethmoid bone. In the whole area you will have the ethmoid bone. Now, ethmoid bone is having the different components which you can see in my lecture of ethmoid bone. Now, here on the crest you will have the articulation with the middle concha. You will have the middle concha on this crest. And what is the function of this upper part or this remaining area? Now, this remaining area is helpful to enclose the air sinus which are present in the ethmoid bone. Now, which group? Answer is anterior ethmoidal air sinuses. So, anterior ethmoidal air sinuses covered from this lateral side by both the maxillary processes. So, maxillary processes are just covering the lateral aspect of the ethmoid bone, and that is the area of anterior nasal air sinuses of ethmoid bone. So, when you will see the ethmoidal crest, what is ethmoidal crest? It is a oblique line on the medial side of the your frontal process of maxilla, and on the crest you will have the articulation of middle concha of ethmoid, plus above the concha the bone is still in contact with the ethmoid bone to close the air sinus, and which air sinus? Anterior ethmoidal sinus. Now, what about this area which is between the ethmoidal crest and this is one more crest? Now, what is the name of this crest? If you remember in the last class I told you this is known as conchal crest. Now, this conchal crest provide attachment to the inferior nasal concha which is a separate bone. If you remember, I told you that there are four bones which are going to enclose this larger this hiatus into a small opening. What are these bones? We have seen here you will have the inferior nasal concha, here you will have the lacrimal bone, here you will have the ethmoid bone, and here you will have the perpendicular plate of palatine bone. So all the four sides you will have the four bone: inferior nasal concha, lacrimal, ethmoid, and palatine. So this area is known as conchal crest. This area is known as ethmoidal crest. Now we will talk about this area which is below the ethmoidal crest. Now this area is become the part of middle meatus, or you can say it is going to form the atrium of middle meatus. Because once here you will have this projection, this shelf-like projection which is known as inferior concha, this area is become the part of inferior meatus. Now above the inferior meatus you will have inferior concha, then you will have the projection here is the middle concha, and the area below the middle concha is known as middle meatus. So this area is known as middle meatus, but this middle meatus extend posteriorly also, and this part is known as atrium of middle meatus. Clear? So what are the structures seen on the inner side of frontal process of maxilla? The most important word is ethmoidal crest. The crest is dividing this surface into the upper and lower part. Upper part is going to again articulate, or you can say cover, the anterior ethmoidal air sinus, and this lower part is going to form the atrium of middle meatus of the nose. Clear? Now we'll move to this small video where you can see this articulation again. This is your frontal process. Now if you rotate this on the medial side, in the frontal process, what you are able to appreciate, this is a midline bone which is your ethmoid bone. What is that? This is the ethmoid bone. Now you can see this shelf-like projection which is known as inferior nasal concha, which is a separate bone. Now when you will see this ethmoid bone is having this projection is known as middle nasal concha. Now this middle nasal concha is articulating with here which is known as ethmoidal crest. What is that? Ethmoidal crest. And this area which is known as atrium of middle meatus. So middle meatus lies above the inferior nasal concha. So this is inferior nasal concha, above that this is the middle meatus, below that this is the inferior meatus. So this part is become atrium of middle meatus, and this is a point of articulation is known as ethmoidal crest. This is the point of articulation is known as ethmoidal crest. So between the ethmoidal crest and conchal crest, this part is the atrium of middle meatus. Clear? Now the another important thing which you are able to see in this small clip is that this is the large opening. Now this is the large opening of the hiatus. Now this hiatus is enclosed anteriorly by the lacrimal bone. This is your inferior nasal concha. From above you can see the projections of your ethmoid bone, and from posterior side you will see the perpendicular plate of palatine bone. Now we will move to the next process is known as alveolar process. Now when you will see the alveolar process, this alveolar process is lower arch border. Arch border means that it is not straight, it is having the curve because it is following this your dentition. So you will have an arch border. It has a socket for the upper teeth which are known as maxillary teeth, and buccinator muscle arises from the area above the molar roots. So if you will see this, so these are the three molar, and above that you will have the origin of buccinator. Now if you see the origin of buccinator, you know that there is a origin here on the mandible. This is the origin from maxilla, and here you will have the origin on the pterygomaxillary raphe. You will have the raphe is known as pterygomandibular raphe. So you will have origin from maxilla, you will have the origin from pterygomandibular raphe, and you will have the origin from the mandible. So in this way you will find this is the origin of buccinator here. Clear? Now what is next is palatine process. Now palatine process is not visible in the norma frontalis. For that you will see the hard palate from below. Now it is a horizontal projection which is forming the anterior 2/3 of the hard palate. Now here in this image, you can see that this is the palatine projection which is coming from both the sides. Now this projection is making the entire two-third of hard palate, and posteriorly this part of the hard palate is formed by the palatine bone. Now this projection, this palatine process of maxilla is having the two surfaces. One surface is superior surface which is towards the nose, and one surface is inferior surface which is towards your oral cavity. Now it is having the three border. Now what are these three border? This is the lateral border, this is the posterior border, and this is the medial border of this process. Clear? So let's see the different areas one by one. First is the features of superior and inferior surface. Now superior surface does not have any specific feature, it is just the convex which is covered by the nasal mucosa. Now when we will come to the inferior surface, that means towards the oral cavity area, in this surface you will find the several small pits, and these depressions or pits are for the palatine gland. Apart from that, you will have the several nutrient foramina on this surface. Now apart from these two things, there are some very important areas or features are present in the hard palate, or you can say towards this oral side of this process. Now what are these? One is groove for greater palatine nerve and vessels. Groove for greater palatine nerve and vessels. Now here you can see that this is the greater palatine foramina, which we have already seen how it forms in my previous class of maxilla part 1. Now from this foramina, what will happen? Your greater palatine nerve and vessels are entering into this area. Now from here, these vessels will go forward along with the nerve, and for that you will find the grooves and the depressions on the hard palate. So you will have these grooves which are present in the posterolateral aspect. They are present in the posterolateral aspect of the hard palate. Now there is one very important area is known as incisive fossa. Now where are the incisors? Now this is your midline. So these are the two incisors of this side and of this side. Now in this area, here you will find a depression is known as incisive fossa. So incisive fossa lies behind the incisors, and it lies at the meeting of two maxilla. So when the two maxillas are meeting, behind these incisors you will have a midline structure is known as incisive fossa. Now this fossa communicates with the oral cavity, nasal cavity by the lateral incisive canals or the incisive canals. Now what is happening basically, that above that you will have the nasal cavity, below you will have oral cavity. Now you don't have a communication generally because there is a canal is present, but this canal is generally completed, or I should say it is not open. That communication is blocked because it is covered by the mucosa. So that is the area which is known as lateral incisive canal or incisive canal. That is a communication between the nose and oral cavity along behind this area of incisors, but this area is not open because it is generally covered by the mucosa, and there are two important things which are transmitting through this canal. Now what are they? From oral cavity to the nose you will have the greater palatine artery. So this artery will go and it will pass through the lateral nasal or lateral incisive canals to enter into the nasal cavity. In the same way, from above, the nasopalatine nerve is coming from the nose and it enters into this area. How the nasopalatine nerve comes, which you can see in this video, that nasopalatine nerve arises into the pterygopalatine fossa. So here you can see this nasopalatine nerve on the lateral side of the nasal septum. So this nasal septum on both the side is having the nasopalatine nerve. So to see the course, we have to remove the maxilla. So we have just removed the maxilla, so the nasopalatine nerve is now very clearly seen, and this nerve is coming anteriorly and it is passing through this canal and it enters into the oral cavity. Clear? And this nasopalatine nerve, if you will track the whole route, you will find that there is a ganglia is known as pterygopalatine ganglia. So from this pterygopalatine ganglia, the nerve is going medially and it is passing through a foramen behind the perpendicular plate of palatine bone, and then it enters into the nasal cavity, and then it runs on the lateral wall of nasal septum approaching this midline, and then it will passes through this incisive canal and enter into the oral cavity. So this is the course of nasopalatine now. In the same way, from lower side you will find that there is a greater palatine groove. In that you will have the greater palatine artery, and the artery will enter in the retrograde direction. Clear? So this is the important thing about this incisive fossa. Now there is one more important feature of the hard palate is known as premaxilla. But this premaxilla is not seen in the mature ossified adult skull. If you want to see the premaxilla, you have to take a young unossified or under immature skull. You will find this area, and this is known as premaxilla. So what is premaxilla? Now suppose these are the two incisors, this is the canine. So this is the one canine and these are the two incisors. Between them you will have a line, suture line. In the same way here you will have a suture line, and these suture lines are approaching this incisive fossa. Now this area which is enclosed here is known as premaxilla. So what is premaxilla? Premaxilla is a area where a suture line passes from the junction between the two incisor and canine towards the incisive fossa, and it is a portion of the bone which lies in front of these suture lines. So this is the area of the bone which lies in front of these suture lines is known as premaxilla. Clear? The important thing about the premaxilla is that this premaxilla is having a different source of origin than the remaining part of this projections of palatine process. Clear? So this is what you can see in the detail where I discussed the embryology of cleft palate. So this is the premaxilla. So where is the premaxilla, or what type of teeth premaxilla carries? Only the incisors. And this premaxilla is very well visible by demarcating these suture lines which are seen into the young skull, not in a well ossified adult skull. Clear? Now we will move to the borders of this process. Now there is a medial border, there is a posterior border, there is a lateral border. Now if you will see the lateral border, this lateral border merge with the body of maxilla, and along this merge line you will find the groove for greater palatine vessels. This is the posterior border. This posterior border merge with the posteriorly placed horizontal plate of palatine bone. So posteriorly you will have horizontal plate of palatine bone which complete your hard palate. Lateral border merge with the fuse with the body. Now we will move to the medial border. Now this is the medial border. Now both sides of medial border joined together in a suture line which is known as intermaxillary suture. What is that? Intermaxillary suture. Now above these, above means that if you will see the area towards the nose. So if we will see area towards the nose, that means its superior surface or midline, you will find that it is going to form a projection is known as nasal crest, and this crest receives the vomer bone from above. It receives the bone from above is the vomer bone, which is visible in this diagram. So here you can see that this is a midline bone which is a vomer bone, and this projection which is produced in the midline by the medial borders is known as nasal crest. Clear? And there is a small projection is seen here by this medial border is known as anterior nasal spine. Clear? So what are the features of medial border? Medial border joined together in the midline, intermaxillary suture, but towards the nasal side, this medial border shows some elevation, and this elevation is known as nasal crest, and it comes out on the anterior side is known as anterior nasal spine. Now sometimes you have this question in your viva that how many crests are present in the maxilla? How many crests are present in the maxilla? So most commonly you have to reply the 4 crests. 4 crests. What are these four crests? The first and most important is anterior lacrimal crest. Now, where is the anterior lacrimal crest? It is a continuation of the inferior orbital margin. So, if you will continue with the inferior orbital margin and you will reach on the medial side, here you will find the anterior lacrimal crest, which is separating this lateral surface of the frontal, this frontal process into the anterior and posterior part. Where is the ethmoidal crest and conchal crest? These both are present on the medial side. Conchal crest is present on the medial side of this frontal process, and it is going to articulate with the middle concha of ethmoid bone. Conchal crest is going to articulate with the inferior nasal concha, which is a separate bone, and nasal crest is formed when the two palatine process fuse together and they will give a elevation into the floor of your nose, which is receiving the vomer bone from above. Clear? So, at the end of this maxilla, we are now understand that whenever you are having the maxilla in your hand, you are able to identify the side. You should able to identify the different bony features, what are the different processes, surfaces, what are the different nerves which are related with the different surfaces, different muscles, and the crest which are important for your viva. So, this is all for the maxilla. Thank you.